We've got three speakers, and I'll try to be brief and then take some questions. I want to talk to you about three items today. The first is testing, the second is economic recovery, and the third is code enforcement compliance. First, on testing. If you have not been tested and you have symptoms, please get tested. We have the resources readily available for you, and most importantly, they're all free. You don't need a doctor's referral, but you do have to make an appointment. That information is on screen right now. Tiger Lane is underused. It could test many more people each and every single day. Please make an appointment and get tested. Also, we have testing sites all over the city, and starting this Friday, we're adding more capacity in Fraser and Hickory Hill. Both sites I'm talking about are through Christ Community Health Services. The Fraser site is located at 969 Fraser Boulevard, and Hickory Hill is at 5366 Mendenhall Mall. These sites are in addition to what's already being provided. All that is to say, there is no reason for you not to get tested if you have symptoms. The resources are there, and they're waiting for you. Please use them. Second, economic recovery. Yesterday, Mayor Lee Harris and I had a good phone call with Governor Bill Lee. He recently announced, Governor Lee did, announced his economic recovery group, which is headed by the Commissioner of Tourism, Mark Ezell. Over the next several weeks, the group will be working closely with the governor's unified command to help navigate the bumpy road to our state's economic recovery. In our call yesterday, the governor wanted to lay out his vision for this new group and how we can work together to get Memphis and Shelby County back to work on a timeline that is safe and works best for our citizens. Tomorrow, locally, we're having our own local economic recovery discussion. The group is made up of members of the Joint Task Force and members of the business community, and will soon loop in Mayor Harris and all the municipal mayors in Shelby County, including me. When it comes time to lift our safer at home order, we want to be ready to get our economy moving safely again. But I want to emphasize that we do not know yet the timing of opening up. We're just planning and making plans on how to do it. There will be more details to come. 3, a quick update on code enforcement compliance. Code enforcement officers, these are city code enforcement officers, have made calls on 261 individual businesses. Well, actually, we've gotten 261 complaints. We've called on 260 of them. We have one left to call on today. 180 of those 260, when we went out to visit, were in compliance at that time. 54 of them were cited and then re-inspected, and we were down to 6 who would not comply even after a second visit. And that number 6 has been fairly consistent for the last week or so, and all of those are car washes. I do think one of those 6 has now agreed to comply. I'd like to introduce Dr. Randolph from the Health Department.
Thank you, Mayor Strickland, and good afternoon to everyone. Today I'd like to give the update on our situation with COVID-19 cases. Shelby County has 1,432 cases of COVID-19. We have 31 deaths. Total tested in Shelby County is 15,082. This gives us a positivity rate of 9.5%. In the state of Tennessee, total cases are 5,832. In the surrounding jurisdictions, Tipton County has 52 cases, DeSoto County, Mississippi, 188 cases, and treated in the county, Arkansas, 116 cases. Yesterday, when I stood before you, a question was asked about the investigation of nursing homes and senior care facilities. And I'd like to take this opportunity to report that currently Shelby County Health Department is investigating a cluster of infections in a number of facilities that house our vulnerable populations. So currently we're investigating the following facilities. Carriage Court Assisted Living Facility has experienced 3 deaths. They have 7 residents that's positive for COVID-19 and 1 staff member that's positive. Christian Care Center of Memphis has 4 residents that tested positive and 3 staff members that tested positive. Parkway Health and Rehabilitation has 8 residents that tested positive and 2 staff members. Heritage at Irene Woods, 5 residents that tested positive and no staff that tested positive. King's Daughters and Sons House has 3 residents that tested positive and 1 staff that tested positive. Delta Specialty Hospital has 3 residents that tested positive and no staff members. And the Village of Germantown has 5 residents that tested positive and 2 staff. So we are engaged in ongoing investigation, and more will be reported as we learn more. Again, we want to echo the request that Mayor Strickland has given about the importance of testing. And we want to let you know that it is available. We strongly encourage you to be tested if you have any symptoms, no matter how mild. If you need to be tested, we need to know who are infected. And also, I just want to dispel this myth that I've heard some folks say that if I get tested, I will come down with the infection, and that is not true. You do not get infected with COVID-19 by being tested. You are found to determine whether you have it or not, but being tested doesn't give it to you. With that, I'm going to turn it over to Director Rollins from the Memphis Police Department.
Good afternoon. I'm Director Rawlings of the Memphis Police Department. I hope all of you are safer at home, practicing good social distancing, good hand hygiene, and wearing face coverings while in public. Together we can slow the spread of COVID-19, but we must take the safer at home orders seriously. Remember, by staying home, using social distancing, washing your hands often, and wearing some type of face covering in public can save lives. We will get through this, but we must follow the guidelines set by the CDC and also the Shelby County Health Department. I want to personally thank all the first responders throughout Shelby County, especially the men and women of the Memphis Police Department, for your tireless efforts in combating the coronavirus. I'm happy to report that in our first responder community, we're doing well despite the challenges we face every day during this epidemic. These men and women on the front lines every day, risking their lives for the citizens of our community, and we should forever be grateful for their service. The priorities of the task force remain the same: safer at home compliance, testing, tracing, and case finding, predicting surge and capacity crossover, preparing for the surge, and also PPE. The number one priority for MPD has always remained the same, and that's to maintain public safety. during this crisis and also keeping our officers safe. We're focusing on educating community about the safer at home orders and also other restrictions that may apply to the situation, and also focus on maintaining or gaining voluntary compliance as opposed to taking enforcement actions. But we will make arrests if necessary. We're doing this by conducting high visibility patrols at hospitals, testing sites, grocery stores, drug stores, essential businesses, in our parks. So far, we've made 3 arrests on violations of the safer at home orders, and we will continue to focus on educating the public and enforcement actions. As far as safer at home violations, the Memphis Police Department has received a total of 388 calls for the month, an average of about 27 calls each day. 8 yesterday, and those were 4 to businesses and 4 to crowds. Most of the calls to businesses are being routed to code, as you heard Mayor Strickland report on, and the health department has taken the primary responsibility to calls for places of worship. 911 call volume is pretty much unchanged compared to last year. We do see some differences in a number of our traffic stops, our alarms, and traffic crashes. But we're still responding to calls and we're still combating violent crime. As far as our mental health, our CIT calls, they have not changed much year over year. As far as the impact of COVID-19 to our first responder community throughout the county, we're still doing okay. Memphis Police Department has 28 employees who are positive, 22 commissioned, 6 civilian, 86 are on quarantine, and 147 have returned to work. As far as Memphis Fire, 20 have tested positive, 27 are on quarantine, and 234 have returned to work. So you can see the Memphis Police Department and Memphis Fire Department and our other first responder communities have been impacted, but we have still been able to maintain our level of service. MPD also has 61 police recruits that are in the academy, and they are scheduled to graduate July 23rd, 2020. On Saturday, we also launched Operation Spring Cleaning. This operation will combat violent crime. Thus far, we made 9 arrests, recovered guns, drugs, and stolen merchandise. This concludes my report, and we will now open up for any questions.
Winnie Wright with Fox 13 Memphis.
Hey there, my question is for Mayor Strickland. Wanted to start off with just this concept of regional reopening on the East Coast and West Coast, how that could possibly play out in the Mid-South, and the challenges presented just because of our geographical proximity to other states with, various orders, and then regional communities that also have various orders, and kind of the process of roping in all those communities.
Well, some of our neighbor states have not closed down, so there's nothing to coordinate to reopen. But we are, within Tennessee, definitely going to coordinate with the governor's task force. With respect to our coronavirus task force that meets every morning, the mayor of West Memphis or his staff is involved in that and participates every single day, and we will try to reach out to him and work with him. If you'll notice, Crittenden County has more positive cases per capita than even Shelby County. Now we have the gross number is so much higher in Memphis, in Shelby County, because our population is more. But Crittenden County has a larger number, despite the really strong efforts the West Memphis mayor has made.
Bradley Broders, Local Memphis 24.
Hi, everyone. I had 2 questions, one for Dr. Randolph. With these new clusters identified at several new assisted living facilities, Mayor Harris touched on potentially a new health directive, maybe some new restrictions or guidance. tied specifically to those facilities with vulnerable populations. Do you anticipate that, support that? And then a follow-up question for Director Rawlings, if there is any data he can share about any differences in violent crime, serious crimes in the last few weeks with these orders in place. Thank you.
Okay, I'll address the nursing home question. Currently, we have an investigation team that goes out to nursing homes whenever we get a report of 2 or more cases to investigate clusters, outbreak. And in that activity in terms of what we do in working with these nursing home or senior care facilities is we look at their infection control and prevention programs. We look to see how their staff are performing in terms of the use of PPE and whether or not the residents are being appropriately quarantined and isolated. And we already have encouraged the senior care facilities to limit and actually prevent who enters the facility. We're encouraging them to make sure that the staff, when they arrive, that the temperatures are checked and that there are questions about whether they're having any symptoms, exposure to someone who possibly could have been infected with COVID-19. And we're also working with them to institute other protocols to try to prevent the spread of this virus in the senior care and nursing facilities. That's one of the areas that we're very concerned about because we do not want this to get out of hand. I'll turn it over to Director Rollins to answer the second question.
All right, on your question regarding violent crime is only slightly up. We're definitely concerned about it, and that's why we launched Operation Spring Cleaning 2020. Operation Spring Cleaning 2020 will focus on violent crime and our hotspots. I was looking at our daily crime today, and our homicides are up. Robbery business are up, so we want our business owners to really pay attention to the operation. If you see something suspicious, we want you to immediately report it to the Memphis Police Department at 545 COPS, or if it is an emergency, dial 911. And carjackings appear to be on the rise, so we want our citizens to really pay attention. We spent the large part of the last 4 years warning our citizens about leaving running cars unattended, leaving keys in cars. So as always, be very cautious, pay attention to your surroundings, and just practice good personal safety practices. I am happy to report that some of our other crimes are down. Our rapes, robbery individuals, but again, if there's one victim, there's one victim too many. And again, we just want everybody to be safe, and if you're safer at home, you can avoid becoming a victim of crime. But if you have something to report, please continue to call Crime Stoppers or report to the Memphis Police Department, as I said, at 545 COPS. Thank you.
Corrine Kennedy with the Commercial Appeal.
Hi, my question is also for Dr. Randolph. In regards to these new outbreaks at the assisted living facilities, why are we seeing 4 being reported at once? Is that due to increased testing or other circumstances? And then what preventative measures are being taken at other facilities that have not yet reported any cases to try and stem the flow of COVID-19 emerging in those facilities?
Well, I think that certainly the increased awareness of the problem associated with COVID-19 infections in nursing facilities have made the directors and the management of these facilities more attuned to their staff in terms of making sure that they are questioned and checked. Also, protocols which are in place for the residents. I think there's closer monitoring and just a more awareness that the resident who all of a sudden has had a change in their mental status, behavior, vital signs, that that person could be infected with COVID-19, and so we are doing more testing. We are encouraging all the facilities to practice preventive measures. Again, screening your staff. Also, they have in place even making sure that residents that they receive from the hospital are tested and they are negative before they arrive to the facility. And it's my understanding that even some facilities have limited EMS folk from entering the facility before being screened also.
Kendall Downing, WMC TV.
Hey, good afternoon, everyone. My question is also with respect to the senior living facilities. What's your message for, a lot of folks out there have a loved one in these facilities. They can't visit them right now. They see that the cases keep going up and there are more facilities that outbreaks are being reported. What's your message to the public who has a vested interest in these facilities, and what should they be doing right now with, the concerns they have about their loved ones who may be in a vulnerable area?
I would advise them to maintain communication with the facility. So even though you cannot go in and directly see your relative or loved one, you should still communicate with the staff and inquire about how they're doing. In some facilities, they have arranged where people can go to the window if their resident is in a room that happens to have a window, where they can go by and just communicate that way. The bottom line is that you should stay engaged and still inquire about the condition and status of your loved one, even though you're not able to see them directly.
Katie Reardon with WKNO. Katie will come back. Winnie Wright with Fox 13 for a follow-up to her original question.
Yeah, and Mayor Strickland, I was just wondering, what would make you feel comfortable to consider regional reopening? At what point would you feel as though your relationship with South Haven, with West Memphis, with all the other neighboring communities is such that you all are in agreement that now is the time? At what point would you feel comfortable with that?
Well, I'm not sure that there have been much shutdown in those areas like there has in Memphis. But let me talk about in general where I feel comfortable in reopening. The overall goal of Safer at Home and of any plan to reopen should be prevent our hospitals from being overrun with patients, to allow them to be able to give the proper care to each and individual patient. So to do that, hopefully the number of cases that we're having is going down. We've reached that peak and we're heading downward. Secondly, that we have plentiful tests that can be given, many more than we have now, because we have to aggressively test and then also isolate those who test positive, put them in their home or in the hospital if they need hospital care, contact all of their contacts and isolate all those contacts. It was explained to me by a former head of the CDC in a teleconference. We need to box this virus in. Testing has to be there. A lot more testing than we have now. Then you have to isolate those who test positive, contact trace all the ones who've been in contact with that person who tests positive, and then isolate those. And you can box in this virus. It's the way South Korea has done it without having to shut down businesses. The number one challenge of doing that, I believe, is having the quantity of test and testing materials that we would need. I think the health department can adequately contact trace, and I think we can get out the orders of isolation and quarantine. It's having those tests that are going to be the real challenge.
Laura Testino with the Commercial Appeal.
This is Jessica Gertler.
Oh, I'm sorry. Hold on just a moment. Laura, are you there? Go ahead.
Yes, I'm here. Can you hear me?
Yes, go right ahead.
Okay, thanks. This question is for Mr. Randolph. In terms of healthcare staffers, are we seeing infections of COVID-19 in our healthcare workers? And if so, is this affecting staffing levels for care for patients?
We have seen some infection among healthcare workers, but it is not drastically affecting our staffers in terms of the availability of healthcare workers. Certainly, one of the priorities for testing include healthcare providers, and also I would say first responders need to also be at that top priority level, as well as people who are hospitalized, the people who have symptoms, and people with chronic medical illnesses and conditions. And again, reiterating the importance of testing. I strongly would encourage all healthcare providers and first responders to be tested.
Jessica Gertler with WREG.
Hey, so one question is, how is your personnel looking at this point? Were you able to get more recruits or recruit more volunteers like you had talked about for contact tracing? And do you have enough people for strike teams to handle these clusters? And one other question is, yesterday you did some testing on our homeless population. Was there any takeaways from that, and how did that go?
Currently, we, through our Medical Reserve Corps, we've had 40 additional volunteers that are helping us with the contact tracing. And presently, we seem to be able to handle that workload. Of course, if we have further outbreaks, our investigation team in terms of the nursing facilities may have to divide into two, but at the present time, we're managing to investigate all the cases that we have.
Katie Rudin with WKNO.
Hey there. Sorry, my mic seemed to not have been working earlier. My questions are for Director Rawlings. Thanks for being here. And I apologize if this sort of got touched on because it shot me out of Zoom for a little bit. But I'm wondering, what are the patterns that you're noticing in how your officers are getting affected? Is it with their own precincts? Is it spread between officer to officer? Or is it mostly their interactions with the community doing their job? And then also, can you go into depth about the sort of PPE protocols that you've assigned to them? Are they being issued masks daily and instructed to wear gloves? And then finally, can you speak to how the number of officers that are currently quarantined, how does that affect your staffing levels? Thanks.
I think you asked 3 questions, so I'll try to hit on those questions. So let's first talk about PPE, because PPE impacts everything that you talked about. We have an infectious disease protocol. Our officers train, through the academy, through their in-service to combat any infectious disease. so they are issued PPE. All of them have PPE and have been instructed to wear their PPE. So our goal is to reduce the number of positives that we have. As far as staffing, I reported earlier that all across the county, to include the Memphis Police Department and Memphis Fire, we managed to ensure that our staffing level was appropriate to respond to our calls for service and to deliver service to the citizens of Memphis. I want to compliment Mayor Strickland for early on changing some of our protocols. We canceled vacations, and we made sure that we were able to serve the citizens of Memphis. As far as and again, our first responders are serving all throughout the county, and again, we should be very proud of them. And the last thing I think you asked about, kind of the infections or where they're coming from. Our first responders represent our community, so you see the same types of exposure that you see in the community. But again, I think what's important for us to focus on is that we have an outstanding group of first responders, some of the best in the nation. If you think about our police officers, our sheriff's deputies, our firefighters, our paramedics and EMTs, and the men and women that are in our hospitals and our healthcare providers are doing an unbelievable job in a circumstance that I've never seen in my 30 years. So we're very proud of what they're doing, and I think we'll continue to serve and help lead our community through this crisis. Thank you.
This concludes our time for the briefing. Does anyone have a final statement? All right, thank you, everyone. This concludes the briefing. Please stay healthy, and we will see you tomorrow.